Hello, everybody, and thank you for joining today's webinar, which is an opportunity for the homelessness and mental health sectors to come together and discuss the development of the federal government's Housing and Homelessness Plan. By way of commencement, I would like to acknowledge that wherever you join this webinar from, you are joining from the lands of the traditional custodians. I am on the land of the Wurundjeri people of the Kulin Nation, and pay my respects to elders past, present and future. And we recognise the intergenerational impact of the history of invasion, dispossession and colonisation, and are committed to the recognition, respect, inclusion and well-being of Australia's First Peoples. And at Mind, we value also the experience and contribution of people from all cultures, sexualities, genders, bodies, spiritualities, ages, abilities and backgrounds. So, just by way of introduction, across Australia, more than 120,000 people experience homelessness on any given night. A piece of data that is probably no surprise to most of the people joining this webinar. Our Mind's Trajectories research that we did with Ahuri shows that mental health challenges can be a very strong indicator of unstable housing and homelessness for a person throughout their life. People struggling with mental health challenges often fall between systems: the mental health system, the housing and homelessness system, and disability support systems. And you don't have to be working in the sector to grasp how mental health challenges can lead to homelessness. Our experience of working in the Homeless to Home program here in Victoria during and post the COVID pandemic gave us experience of 68% of those people experiencing homelessness had a serious mental health challenge and had no active engagement with clinical support. People without access to mental health supports often struggle to maintain a job, a relationship, manage finances, all the things that can then make it difficult to keep a roof over your head. And our Trajectories research also shows how the converse is true. Financial strain, job and housing insecurity in turn negatively impact people's mental health and wellbeing. At Mind and with the Haven Australia Foundation, we believe we've identified a new and effective model of housing with mental health support for people with a psychosocial disability that puts recovery and secure housing at the centre of that support. More than 15% of our Haven residents were experiencing homelessness before moving into a Haven residence in the past financial year alone. And our evaluation suggests that up to 40% were at risk of homelessness. And they now have stable, secure and supported accommodation, an essential component of people's recovery journey. But even people who don't require long-term mental health and housing support might require it at some point in their lives. Leaving hospital or a rehab service is just such a point for many, but also one where our system too frequently fails, sending people on a cycle perpetual interactions with clinical and homelessness systems. A clearer focus on service navigation through complex systems, a better range of different types of integrated models of support and housing, and holding systems to account to deliver actual outcomes to people who access their services are all part of the change that we think we need to see. And the National Housing and Homelessness Plan is a major opportunity in front of us, an opportunity to contribute to a national plan to influence the significant reforms that we think are needed to address the housing, homelessness and mental health challenges that we are facing across Australia. So through this session and then further collaboration across our sectors, we have the opportunity to lead meaningful change for Australians experiencing both mental ill health, but also serious housing insecurity and homelessness. Most importantly, change that listens to people with a lived and living experience of mental ill health or homelessness, and ensuring that they are part of the policy design. So today's session includes presentation from Mind's Executive Director of Housing Strategy, Mark Heaney, The Senior Manager of Professional Service at Ahuri, Nicola Brackertz, Homelessness Australia CEO Kate Colvin, and Dr. Elroy Dern, an academic from RMIT and a research fellow at the Summer Foundation. There is an opportunity for Q&A at the end of the session, so please use your Q&A or chat functions and we will do our best to answer your questions. If you can't stay for the full hour, a video recording and summary news article will be published on our website and circulated later this week. And we encourage you to share these materials with your networks as well as people make submissions to the new National Homelessness Plan. So it's now my pleasure to hand over to Kate Colvin, the CEO of Homelessness Australia, to talk about how to submit to the Housing and Homelessness Plan and some guidelines for building your own submission. Welcome, Kate.
Thanks so much, Jill, and hi to everyone. So I want to just talk a little bit about the National Housing and Homelessness Plan, because of course this is a big plan. Government, it's a 10-year strategy. And part of the reason that we've been super excited about the government making a commitment to a 10-year housing and homelessness plan is because it has the potential to be quite transformative. So ideally, if it was to be transformative, what we'd want to see a national plan do is really interrogate the questions about why we have homelessness and what needs to change so that we don't have homelessness. And a lot of that answers to those questions are in the prevention space. How do we prevent people from becoming homeless? And I think there's really particular issues in relation to how we prevent people becoming homeless if they've got a serious mental illness. So that's what we're hoping to hear from you today, but also hear about if someone does become homeless or is at imminent risk of homelessness and also has a serious mental illness, how do we best respond to that so that someone's experience of homelessness is very brief, they're supported back into housing and then have the support they need to sustain that housing. So we need to hear from you about what that support might look like and what that sort of service, it might not just be one service that's needed for people, but a range, and what that service mix might look like. So to guide people, as Jill was saying, in terms of writing a submission, submissions are due at on the 22nd of September, though I think some people may have an extension for a bit longer. We've on the Homelessness Australia website, and I'll post this in the chat in a bit, a guide to writing a submission that steps through what kind of questions you might want to answer in terms of prevention, early intervention when someone's homeless, and then long-term supports for people to stay in a home. The questions that we're sort of posing and suggestions that we're making are a little different to what the government have put in their issues paper. And part of the challenge there is because it's a National Housing and Homelessness Plan, a lot of the issues paper is very focused on the housing part of that. And there's some very particular issues around homelessness that we're encouraging people to share with the government. So I'll post a link to that. But mostly today I want to hear from you and hear about what you think needs to be in the National Housing and Homelessness Plan. Of course, that will influence Homelessness Australia's submission. And also I forgot to say many thanks to Mind Australia for working with us on this session, because it's really important to hear from the housing and from the homelessness and mental health sectors together, because it is a shared conversation about what needs to change to address homelessness. So I'll finish up there and pass over to Mark Heaney, who's going to take us through, I think, some of the research that Mind Australia has been involved with.
Thanks so much, Kate. I do have a short presentation that will come up on your screens shortly. I'd also like to acknowledge anybody at this webinar today that has their own lived experience of homelessness as well, and really welcome in the Q&A session participation for people who are peer workers or have their own lived experience in this space in a little while. So just a bit of a summary around the National Housing and Homelessness Plan. What's really important about this plan is that it is intended to work in conjunction with the current state housing and homelessness plans. You can see in front of you what all of those plans are, and I very much encourage everybody when considering a submission to really think about what's currently within their own state's plans. We are very fortunate that we do have participants with us today attending this webinar all across the country. And so we really want to ensure that we can have a very national focus as we have this discussion as well. So the National Housing and Homelessness Plan, as part of that process, it is a 10-year plan. The feedback to that plan, as Kate mentioned, is due on the 22nd of September. And given this is going to be replacing the National Housing and Homelessness Agreement, which did expire on the 30th of June of this year, that agreement has been extended another 12 months whilst the federal government and the community as a whole continue to actually design what this plan will look like. So some of the main pieces of funding commitments that the Commonwealth have already announced as part of this plan is that there's going to be a 15% increase to Commonwealth rent assistance. That's going to be occurring from the end of this month. There's also, as I'm sure a lot of you would have seen, there's a $10 billion Housing Australia Future Fund, which is supposed to commit 30,000 new social and affordable homes. For those who are keeping an eye on the political space, you would probably see that that piece of legislation continues to get held up within the Senate, and there's a lot of, I guess, concern around that funding agreement actually going through, considering we're in such a critical situation to actually ensure that that does go through. The third most relevant funding commitment that has also come about is a $2 billion social housing accelerator, which was announced in June, and that's to be delivered by states and territories. Whether that's going to be delivered as public housing through the states or that will actually be passed on to community housing providers to then deliver, I guess, innovative and new social housing is yet to be seen. Next slide, thanks. So our current situation of homelessness in Australia, as Jill mentioned earlier on, there's 122,400 people are estimated to be experiencing homelessness compared to 116,216. We might just click through all of these, thanks. And what I guess is very concerning is that looking at homelessness amongst First Nations people, that there was 24,930 First Nations people experiencing homelessness, and that was up 6.4% compared to 2016. This represents 1 in 5 of all people experiencing homelessness in Australia, and that is equally and more concerning when we do think about that First Nations people make up 3.2% of the total population. On top of that, of the 122,000 people experiencing homelessness, 23% of all of those individuals were aged between 12 and 24 years of age. And we also know through research and work that Mental Health Australia have done is that at least 31,000 people across Australia living with mental health issues are at risk or experiencing homelessness. All of this has been continually compounded by the fact that renting is really hard for most people within the private rental market, and that we've seen, as reported within the issues paper, that rent has gone up by 28.4% between September 2020 and May 2023. So today we're very much talking about, I guess, how all of government can really work towards finding ways to prevent homelessness, but actually trying to find strong services at the moment that actually have been helping to avoid homelessness and to fix homelessness across the community. We see the NDIS, particularly supporting people with a psychosocial disability, a really key part to solve this issue. But unfortunately, work that has been done to try to ensure the NDIS does actually put in work to help solve these issues has not actually been heard. So we understood that the NDIS Joint Standing Committee did not support the recommendations to better support people with a disability experiencing homelessness. That's really to develop a strategy to engage the homelessness community, as well as introducing specialist homelessness liaison officers. So there's a lot more work that we really need to do to recognise that the NDIS, as well as the National Housing and Homelessness Plan, can work in collaboration to ensure that people with a disability can avoid entering into homelessness. Next slide. Thanks, Keegan. So just this is, I guess, a more current overview of what the NDIS and particularly people with a psychosocial disability experience on a day-to-day basis within the scheme. One of the key areas that I'll just point out within this slide is that within the NDIS, there's 18% of participants have a psychosocial disability. The majority, that is a primary diagnosis of a psychosocial disability, but also secondary. What is a really sobering fact is that 36% of participants with a psychosocial disability have a goal around where I live, which is very much around evidence that a lot of people in the scheme with a psychosocial disability have unstable housing, or that is very much a goal that they require to be able to achieve stable housing with that necessary support as well. Part of what we have seen within the NDIS with changing in the home and living policy is that people with a psychosocial disability are no longer getting access to that support to access supported independent living. So we've seen that actually decrease over time, and that 5% of NDIS participants currently have SIL funding, and of which 11% are participants with a psychosocial disability as well. So you can just see on your right of the screen around some other statistics that are associated with psychosocial disability within the NDIS. Also, I guess the impact to our economy as well, that $56.7 million is a cost across our economy for as a result of people having severe mental illness. And that we have seen as part of the Productivity Commission's report in 2020, that it's estimated that 150,000 people are currently missing out who would really benefit from that level of support. We know with the NDIS review, there's a huge amount of work happening. We are starting to see areas where the NDIS is letting us know what a new type of scheme will look like. But around home and living, that is still an area where there's a lot of concern or a lack of information coming out as to how home and living will support people with a disability across Australia. Thanks, Keegan. So this slide, I tried not to break records in having the most amount of acronyms in the one slide, but I may have actually achieved that within here. What I really wanted to demonstrate here is the amount of programs across the country that have been created to really prevent people with a psychosocial disability entering into homelessness or to maintain social housing. So we can see that the housing continuum, that there's starting at people experiencing homelessness all the way through to affordable home ownership towards your right of screen. And that's intertwined with, I guess, a level of support that people might require along the way. We have across the country different types of funding that supports people, and some of these funding and services have been operating for a very long period of time. So, for example, just to pull out a few, we have J2SI there, which stands for Journey to Social Inclusion, which is a housing first model that Sacred Heart Mission have been delivering for over a decade now. We also have the Doorway program that Wellways have been also supporting, which is in another housing first model, which is within the private rental market. We have a range of NDIS services, which I guess we believe are at risk due to the current review, that again, there's a lot of evidence to support the work that they have been achieving, particularly the Haven model that the Haven Foundation and Mind Australia deliver. which has a very strong evidence base that La Trobe University have been evaluating that can prevent homelessness. What's really interesting when you're looking at HASP and HASI, that all stands for Housing Accommodation Support Service or Program or Initiative. They are all long-standing programs that are between New South Wales, South Australia and Queensland and WA that have been working. Some aren't operating anymore because of the transition to the NDIS. But again, there's some really strong evidence associated with those programs and some strong outcomes that people are achieving to actually support with maintaining stable housing and with that support as well. And of what Jill also mentioned earlier, we have that Homelessness to Home program, which is soon to be, I guess, finishing in the not too distant future, which was funded through the state government as a result of the pandemic here in Victoria. So this is absolutely not an exhaustive list. This is just a very small snapshot of many, many different housing and support programs that have been funded short-term as pilots to really help provide that stable housing with support for people with significant mental illness. And we really call upon the government to think about some of the value and the evidence base from these programs whilst it thinks about putting together a 10-year plan to be able to support and prevent people experiencing homelessness. Just the next slide. Thanks. So before I hand over to Nicola, this is just, I guess, particularly with what we've seen out of a lot of research, but really is simply what we know safe and supported housing achieves. We know that it reduces healthcare costs. We know that it increases wellbeing and it increases social inclusion. What we also know as coming out of our Haven evaluation is it also avoids and actually decreases the reliance on health services, particularly the reliance on psychiatric inpatient units as well. And we know that that has amazing benefits to people if we can actually avoid people having to use the healthcare system and having to use an inpatient service, because if we can maintain people's wellness within the community and actually intervene very early, that's going to achieve much greater outcomes. We also know with the integration of psychosocial support and housing that it has a significant impact on increased recovery, and also it has a reduced lifetime burden on the funding mechanism and the scheme, and in which case we're talking about the NDIS, that we recognise if you provide that support to people earlier on to help people build their capacity, it can reduce that reliance at a later date as well. This next slide. And so part of, I guess, just before I hand over to Nicola, we're really wanting to ensure that the NDIS housing and supports of people with a psychosocial disability are really well understood by the Commonwealth when designing the National Housing and Homelessness Plan. And we do also recognise that some people who might be experiencing primary homelessness, or they might be utilising an inpatient setting or a subacute setting for a long period of time, may require some transitional residential support before moving into more stable housing as well. So we do see that, I guess, that there is a strong sense of being able to achieve stable housing for people with significant mental health issues. Often there does need to be a period of transitional residential or rehabilitation support as well. And so we are seeing a lot of evidence come about as to why that is important, to actually ensure that people can then build that capacity, build those skills to then be able to live successfully into other types of housing with that less support as well. So I'll now pass over to Dr. Nicola Brackett, who will talk a bit more about the research that Ahuri and Mind and other research that Ahuri have been doing. Thanks, Nicola.
Thanks so much, Mark, for the introduction, and thanks also Kate and Jill for setting the scene so well. My presentation today is going to be in two parts. One is going to be the view from above, that is sort of a systems perspective, and I think it's really important in thinking about a national housing and homelessness plan to understand how the system works or doesn't work. And then the second part is about the view from below. What does it look like for the particular people who are trying to access the system and are trying to get help? And that second part draws on the research that Uhuri did with Mind Australia on the Trajectories project. So Keegan, if you could go to the next slide, please. And then straight to the next slide. Okay, so I think the first thing that is really important to understand when we're talking about a national housing and homelessness plan is that at the present time, there actually is no housing and homelessness system in Australia. So if we think of a system, it's like a part that works together and creates a holistic one. That's not the case in Australia at the moment. So we have some responsibilities that are with the Commonwealth. There are some responsibilities that are within the purview of the state and territory governments. And then there are some areas that are in the purview of local governments. And so it's necessary for those parts of government to work together. But even within the various levels of government, so for example, within the states and territories, I think we could argue that each state and territory has their own type of housing and homelessness system. But even within those areas, the kind of responsibilities are distributed across various agencies and departments and so on, and they don't necessarily always work together well, communicate, or even have the same kind of, let's say, mission statement or view for the future. So basically, at the state and territory levels, housing responsibilities are fragmented across the various agencies, and each of those agencies has also a very limited remit for how they can operate. The key agreement in terms of the housing and homelessness system, or especially in terms of homelessness, is the National Housing and Homelessness Agreement. But it's important to note that the Productivity Commission did a review of the agreement last year, and they noted that the National Housing and Homelessness Agreement, while it's intended to improve access to affordable, safe and sustainable housing, it's ineffective. It doesn't foster collaboration between governments or hold governments to account. So it's in essence a funding agreement rather than a blueprint for reform or a blueprint for how the various parts of the system should work together. The other really important point to keep in mind when we talk about especially homeless is that a lot of these, in policy making, a lot of these issues around homelessness have been conceived of as welfare issues. So in addressing welfare issues, it then means we provide services and housing to individuals and pin it on individual responsibility rather than taking sort of a whole of systems approach to solving the problem. And so what I'm trying to say here is that because there is no one system, not everyone's pulling in the same direction, and it's very difficult to get a national housing and homelessness system that is effective if there's actually no unified system at the moment. And the kind of systemic constraints, they're at odds with the complex and interdependent nature of the housing system. And it's really a barrier to coherently addressing the challenges. And so Keegan, if you could go to the next slide and then straight on to the next slide. So the question is then, what would need to be in a meaningful national strategy to address some of those problems? So at a systems level, a meaningful national strategy would need to coordinate policy development and implementation across the different levels of government, but also across the different kind of agencies in the public, private, and not-for-profit sectors. In order to get everyone on the same side, it would need to be mission-driven and ensure that everybody has the same aim. So I've put here, for example, the aim could be, the mission could be, everyone in Australia has adequate housing. The next question is then, how do we get everybody to commit to the same kind of mission? So a suggestion from Uhuri research is that we draw on some of the international obligations or conventions that Australia is already a party to, such as the Sustainable Development Goals. So that would be a way of saying Australia already subscribes to these. This is a way of developing a shared mission in relation to providing housing and having a national strategy. And that is a way to then build the constituency to get the various actors with the various different agendas on the same page to do the same thing. And again, in not having a national system and not having a coherent strategy at this point in time, there's also no lead agency or no one agency that is building that kind of constituency, that is leading the way, that is coordinating the various actors. So another really important thing in developing a meaningful national strategy would be to have a dedicated lead agency that coordinates these efforts. We might think there, for example, of Canada, which has the National Housing Council, which fulfills that function in Canada. And then finally, to be meaningful, a national strategy would need to be broadly scoped. And that's not just looking at one particular area of housing, but at the various parts of the system that work together. And so, Keegan, if you go to the next slide, it just shows a table that would sort of make it a little bit clearer. So in the bottom left corner there, where you see social housing and homelessness, these are the areas that are currently covered by the National Housing and Homelessness Agreement. But as you can see, like from the table, that's only a small area. There are other parts of the system that go into it as well. So, for example, if a national strategy might expand out to have new policy areas, new core policy areas in relation to rental, in relation to first home buyers assistance, in relation to residential tenancies laws, which are currently in the purview of the states, and they're quite different. And also in terms of having building quality and accessibility. And I guess, again, that is really relevant, particularly also for people with mental health issues, that it's the right kind of dwellings and the right quality in the right place. And then the sort of yellow area that you're looking at there, those are policy areas that, again, would need to be aligned to make the system more effective in relation to taxation, housing-related taxation. We might think there, for example, of negative gearing or stamp duty, issues around housing finance, and of course, planning and development. And then all of this sits within the broader system, of macroeconomic policy, employment, skills, and so forth. And I might just pick out their welfare and retirement incomes, because again, the welfare settings are really, they affect housing and homelessness issues quite significantly in terms of people's ability to live a dignified life, to be able to afford housing, to be able to access the kind of supports that they need. So that is part one of my presentation. So we'll then skip on to the next one. Keegan, if you can go to the next slide, and then the next slide. So this part of my talk talks about the Trajectories project that Huri did with Mind Australia. It was called The Interplay Between Mental Health and Housing Pathways, and it ran from, I think, 2018 to 2020, something like that. It was a lot longer than we had initially anticipated. And what we aimed to do is develop an applied understanding of the housing and mental health pathways of people with lived experience of mental health issues, to understand how those pathways interact and intersect, and where the potential points for intervention are. If we can then go to the next slide, please. And it was quite a broad program of research. We did an evidence review of the Australian and international literature. We did a quantitative analysis of the Hilda and Journey's Home datasets, where Hilda is the household income and labour household income and labour survey. Anyway, it's a longitudinal dataset that follows individuals over a period, so you can see changes in the individuals' stages of life, and it looks at particular aspects of housing and mental health and family formation and other things like that. We also ran focus groups with service providers from the housing and mental health sectors. And we did a really broad program of engagement with people with lived experience of housing and mental health difficulties. This included consumers as well as carers. We spoke to over 130 participants in 14 locations across Australia. And then we synthesised the findings across all the research streams. And finally, we also conducted some policy development workshops to identify what the key priority areas would be for policy development. So if we can then go to the next slide, please. So what we found all up, and this is the summary of the findings primarily from the quantitative analysis, that's the analysis of the Hilda dataset and the Journey's Home dataset. We found that secure housing is foundational for mental health recovery, that poor mental health contributes to housing instability, and vice versa, housing instability can be a contributor to poor mental health. And I suppose that's not really that surprising if you think that someone is anxious about whether they can continue to live where they are, or they don't know where to live, that this contributes to poor mental health. And similarly, if you're struggling to maintain your mental health, it is difficult also to focus on keeping your tenancy and be able to work and pay for the rent. And we found that there's particularly strong association between financial insecurity and mental health issues and the ability to keep housing. Another interesting research finding was that most people recover relatively quickly from a mental health episode, but that there is a small proportion that experience persistent and recurrent mental ill health, and that it is those that struggle the most to maintain their housing and are most at risk of homelessness. We also identified a range of mediating factors that can soften the relationship between housing and mental ill health, and those are things like social support through families and friends, or vice versa, a lack of social support and isolation and loneliness. Good general health was generally of benefit to people. The ability to access health and mental health services was really important as a mitigating factor. And critical life events were also very important. So, for example, family formation, birth of a child, or vice versa, a divorce, or losing a person's job. So if we could then go to the next slide, please. So overall, particularly from the qualitative consultations from speaking to consumers and carers, we identified that there were typical trajectories that people experienced when they tried to access the housing and mental health system. And first, it's important to note that none of these trajectories are linear. There are no linear trajectories for recovery. People can cross between these different types of trajectories that they experience. So one of the quite common, unfortunately, trajectories was those who are excluded from the help that they needed, and that was could be because people were not eligible to access the housing or the mental health support that they needed, and they just couldn't, or that support wasn't available in the area where they lived. So they were excluded from the help that they needed. Another trajectory was that of being stuck without adequate support. And this is where we might think of people who are stuck in institutions that are inappropriate for them, that are living in inappropriate housing, or they're forced to live with their family when it's not appropriate for them. And they're stuck there because there are no options for them to exit their current situation. And there are no pathways where they can work towards a better accommodation in the future, or access better mental health services in the future. Now, the third trajectory is probably the most common trajectory that we came across, and we called this cycling. And it's really, rather than going in a circle, it's marked by a downward spiral in which people enter into and drop out of the system repeatedly. But each time they enter into and drop out of the system, people's resources are progressively eroded, their financial resources, their social resources, their resilience. So basically, it's a downward trajectory. And I think it's it's an indication of a system that is keeping people trapped within the system, and rather than helping them upwards and onwards on a path to recovery, it traps people within the system and leads them on a downward spiral. So things are getting worse for them rather than better. So there were two positive trajectories. One was the stabilizing trajectory, which was characterized by people who had access to safe, secure, and appropriate and affordable housing. They could get the mental health support that they needed, and they had helped to facilitate meaningful social connections and had financial stability of a degree. So in the stabilizing trajectory, people weren't fully recovered yet, but they felt that they were at a place where they could work towards their recovery. And the final trajectory was the well-supported trajectory. And in that, people felt that they had the housing and the level of care that they needed. They felt that they were managing well. They felt that if something happened to them, they knew where they could get help, and they were confident that they could access the help that they needed. And the level of care that they had aligned with their needs. So it's not one set level of care. In the well-supported trajectory, the care a person needs or has access to is the kind of level of care that they want and that they feel that they require. So if we could move to the next slide, please, then. And then the next slide, Keegan. All right, so then I will just summarize the three policy priorities that came out of the research overall. And the first is to provide genuine choice and control in housing by increasing the availability of a diversity of safe, secure, appropriate, and affordable housing for people with lived experience of mental ill health and housing insecurity. And I mean, I suppose basically that means people need to have access to the housing and the help that they need. The second is support to sustain tenancies for people with lived experience of mental ill health so that people can live independently. And the third is to strengthen early intervention and prevention. And we will then go to the final slide. I just want to encourage you all that the problem is solvable, but solving the problem requires change at the systems level as well as at the program level. Thank you. And I'll pass on to Elroy now.
Thanks, Nicola. Thanks. That was a really insightful overview of the research and really informative. Hey, thanks to Mind Australia and Housing Australia for this invitation to speak today. Before I begin, I'd like to acknowledge the Wurundjeri Woiwurrung people as the traditional owners of the land from which I'm speaking today, and pay my respects to elders past, present and emerging. And I extend that respect to Aboriginal and Torres Strait Islanders people here today. I'd like to acknowledge also mental health consumers here today and mental health carers, and invite your feedback on this presentation. In this presentation, I'll provide evidence to support the argument that supported residential services need to be acknowledged as a form of homelessness, as a catalyst for creating pathways out of these settings. Next slide, please. Firstly, I'll give an overview of SRS and other private congregate care environments. Then, based on research findings, I'll show two things. First, borrowing a term from Nicola's trajectory study, how people with psychosocial disability living in SRS are effectively stuck with inadequate support or pathways out of these settings. And secondly, based on the ABS definition of homelessness, how SRS do not meet core elements of home. I'll conclude that SRS and other private congregate care settings need to be acknowledged as a form of homelessness in the National Housing and Homelessness Plan. Next slide, please. So SRS are private institutions that came out of deinstitutionalisation and continue to operate today. They're known collectively as private congregate care facilities, and we see them in Australia and internationally. These are a particular group of like facilities that emerged during deinstitutionalisation to house people who would otherwise have been homeless. Victorian SRS, which are the focus of this study and this presentation today, are not-for-profit settings, are for-profit settings regulated under the SRS Act. They house up to 80 people, some in shared rooms. The fee paid by residents is 85 to 95% of the disability support pension. And only the proprietor, who's often not present at the facility, is required to have qualifications, albeit very minimal qualifications, Certificate 4 in disability and aged care. So SRS offer no recovery or rehabilitation support. SRS remain the default discharge option from mental health facilities and homelessness for people in Victoria with psychosocial disability who have nowhere else to go. And in Victoria, these house around 4,000 people. Next slide, please, Keegan. The evidence I'll present today comes from my PhD study, which was an ethnographic study undertaken in 2 SRS in the eastern region of Melbourne. Ethnography involves observing people in their own environment to understand their experiences and perspectives and everyday practices. The study was conducted over 18 months between 2017 and 2019. The focus of the study was on the choices participants were making in the NDIS context and their outcomes. I visited each SRS 4 to 6 hours per week intermittently over the period and interviewed 12 residents 3 times over 18 months, as well as interviewing close others, including SRS proprietors. Next slide, please, Keegan. Now, just turning to the first part of the research findings based on interviews with 12 residents, the demographics and housing history of the 12 participants showed a really strong relationship between living in SRS and homelessness. And you can see in the third column that most participants had lived in multiple SRSs. In the fourth column, you can see that half of the participants had lived in more than 3 places over the past 5 years. And the last column shows that 7 out of the 12 participants had experienced homelessness more than 4 times. So this creates a really strong picture of a population experiencing very little stability or security. Next slide. As the study progressed, it became clear that for many participants, moving out of SRS was one of their main goals. And so this became the focus of the study. 11 out of 12 participants expressed a wish to move out of SRS into independent housing, as you can see in column 3. However, 18 months after the study commenced, little transformation had taken place in most participants' lives. All participants who wanted the NDIS were receiving plans ranging between $29,000 and $75,000. But the goal of independent living was only evident in the plans of 4 participants. Where independent living was in their NDIS plans, there was very little action. And by the end of the study, only 3 residents had moved into independent housing. Next slide, please. The ABS definition of homelessness is informed by an understanding of homelessness as homelessness, not rooflessness. It emphasises the core elements of home in Anglo-American and European interpretations of the meaning of home. My research indicates SRS lack core elements of home. Residents experience little security or stability. There's little privacy. In this study, 2 people shared a bathroom, and some residents shared a bedroom with another resident with only a curtain between them. Residents in SRS often feel unsafe, and when bullying or violence or other incidents occur, they find that no one listens and there's no one there to help. These are institutional environments over which residents have very little control. Who you live with, doing your own washing, even making a cup of tea for a visitor are just not options. Further to this, the ABS definition states that a person is considered homeless if their current housing arrangement is inadequate or they do not have suitable accommodation alternatives. So under this definition, many SRS residents would be considered homeless, certainly most of the people in this study. SRS have inadequate staff ratios, support needs of many residents are unable to be met. The untherapeutic nature of SRS has a negative impact on mental health, leaving some people in a revolving door between mental health facilities and SRS. And the SRS fee takes up most of a person's pension, leaving a person living in poverty with very few options to move into independent housing. Next slide, please. So why are pathways out of SRS blocked? This begins with institutional arrangements, as it's the function that SRS perform for the state by accommodating people being discharged from mental health facilities and homelessness services, and their subsidisation and regulation by government, which creates the framework within which SRS are viewed as a legitimate, acceptable and necessary setting. This research showed that there was a tacit acceptance of residents living in SRS by many workers and people around residents, including SRS proprietors, a view that SRS are needed and that people couldn't live anywhere else. Sitting alongside this was the institutionalisation and powerlessness of residents to change their situation, and the disaculturation that comes from the experience of institutionalisation, the loss of skills needing to be independent. And there was also a significant lack of independent advocacy and support for people in this study who did want to move. Next slide, please. SRS and PCC have been the subject of many inquiries over 40 or more years, and they've received the focus of 2 royal commissions where they've been found to be substandard, inadequate and inappropriate. From the many examples that I could have drawn on today, I quote from Hearing 26 of the Disability Royal Commission last year, where the focus was on homelessness, boarding houses, hostels and SRS. And as Commissioner Ryan noted, it looks to me like this is a broken model which needs to be significantly reformed or abolished altogether. Next slide, please. So I've presented the argument today that SRS do not meet the core elements of home, and that many people living in SRS are effectively stuck with inadequate support and no way out of these settings. Such are the structural constraints that the dream of living independently in a house with a partner and a dog, a normative expectation for many, and depicted here by study participant Madison, is just not achievable for most SRS residents with psychosocial disability. I'll conclude by returning to the key message that I started with. SRS and other PCC need to be acknowledged as a form of homelessness in the National Housing and Homelessness Plan. This acknowledgement is needed as a catalyst for creating pathways into secure, affordable, safe housing for people with psychosocial disability. Advocates are calling for pathways out of these settings. If you're interested in hearing more about this issue, contact the PCC Alliance, and please email me if you're interested in knowing more about the research. Back to you, Mark, and thanks very much.
Thanks so much, Ori. It's absolutely fascinating research that you've undertaken. We have unfortunately gone over time as speakers, so I do apologise to people that are attending. We do have a couple of questions that have come through, so I will go through them quickly and ask. I know that there was one around young people that had come through, but I might just go to another couple as well. What would an ideal housing and homelessness service system look like for people with significant mental health issues? I know that that's a massive question, but does any of the panelists want to have a go at being able to provide some, I guess, input as to what that could look like?
Yeah, I can have a go. And I'm looking there at the well-supported trajectory from the Trajectories project, and like an ideal system would be a system where people can access the help when they need it. They are able to access the level of mental health support that they need when they need it. They're able to access the type of housing that they need when they need it, and they have a choice of the kind of housing that they want to be in. So I think it's about having options available and not just having a very stressed and residualized system where, people have to take whatever option comes up because that is their only option. That would be my main point about that. And just to harp on back about my point earlier about a systems approach, and I mean, to make that happen, it really needs more than individualized programs. It needs sort of an overarching strategy across the state or the nation, as that might be, to make that happen.
Thanks, Nicola.
Can I just add to that, Mark? Sorry,
Sure.
I concur with everything Nicola said, but there's a lot of international research that shows that the Housing First model, which everything Nicola said sort of fits within the description of that model, but just perhaps one thing to add, which is that people need to be able to have their support move with them through different housing options. So, and I think that's really captured in the idea of choice and control. So someone might be in one housing situation and that doesn't suit them. They may need to move to another or want to move to another housing situation that suits them better. But if they then mean that they lose their support because the support is just attached to the housing, then people can find it hard to sustain their housing. So having that support able to attach to the person and able to move with them is quite an important element.
Thanks, Kate. We've had a couple of questions just to ensure that we put some of those links, and particularly to your submission guidelines, Kate, into the chat, which we will do. But a question that had come through to me for you, Kate, was what do you envisage to be the next process here, and when will the plan likely come about?
So we're expecting the government to be, so they'll be receiving submissions through sort of till about October. Then we're expecting them to put a draft plan, which we wouldn't necessarily expect to see, to the Housing and Homelessness Ministers. So that's both state and federal ministers. And then presumably there'd be discussion and maybe a bit of back and forth in that group. I think roughly we're expecting a national plan to be released publicly probably halfway through next year. You know, the government's indicated it would come out before the new National Housing and Homelessness Agreement, which is due at the end of June next year. But I think I wouldn't be terribly surprised if it did come later than that, because it is, I think, quite a complicated and process, and there might be disagreement between different levels of government, or indeed between different players in the federal government.
Thanks, Kate. Just a question for Elroy. Elroy, what can the community actively do to advocate for SRSs to, I guess, be wound down, but also what other alternative housing opportunities are there for people living in an SRS?
Well, I think currently there are very few opportunities for people living in SRS because they're just not visible as a homelessness population, and they're a hard to reach group. Well, not hard to reach, but people aren't going out and seeking, information about what people's housing needs and preferences are in those settings because they consider them already adequately housed. But I think, Nicola's already pointed, I think, to, and so in your presentation as well, both really comprehensive about the range of pathways out there and options that are available, I think. Yeah. What can people do to advocate? Look, we're still working on that with the Private Congregate Care Alliance. This is a great group of about 12 sector agencies working really hard for systemic change in this area. So if you are interested, contact us and, join the alliance.
Thanks, Elroy. And just seeing, Kieran, your question in relation to you work in a specialist homelessness service in New South Wales. Is there any information that can be relevant for you to read which could assist in supporting individuals who receive NDI support in a refuge setting? We believe that there is. I'll put some links in there post the presentation, Kieran. And just a question from Daniel Robertson. Is there significant potential for delivering tenancy sustainment support services via peer workforce, via qualifications like Certificate 4 in mental health peer work? Should money be spent promoting this as a pathway for lived experience cohort? Absolutely, Daniel. I think that being able to support people who are a peer worker to be able to work in that space, and absolutely Certificate 4 is seen to be a relevant qualification. We see that to be the minimum qualification at Mind, but being able to deliver tenancy sustainment support services via a peer workforce is a fantastic idea. We're almost out of time. I'm now going to throw back to Jill Callister for final comments and next steps. Thanks, Jill.
Thanks, Mark, and thank you to all the speakers. I think you'll agree that the information in this webinar this morning is very rich and deep, and I hope that what it does is really help you amplify conversations throughout all of your networks about the submissions that you will make to the national plan. Please remember Kate's point about prevention, but when you think about Nicola and Mark and Elroy's presentations, think about that we're not just talking about everyone with a mental illness and everyone that's homeless. There are some people that need more support for longer, other people that need more short, sharp support, and understanding how different people will receive their support is a critical part of how we help influence and shape, hopefully, a future plan. Particularly want to thank Kate and Homelessness Australia for the partnership and the opportunity to have this webinar today to focus on this issue. But in particular, thank you to all our speakers. We greatly appreciate the work that we do with you here at Mind Australia in support of people with mental health challenges who are also have housing and homelessness concerns. So many thanks. Please use this as the start of a conversation and think about your submissions. Goodbye.